whole healthcare industry is going to change dramatically in the next couple of years.
To chronic disease management and the preventative aspect of care.
AI can now understand the key clinical concepts of what's being verbalized in healthcare.
Welcome to Leaders in Healthcare. I'm Dr. Jordan Vollrath, physician, entrepreneur, and Chief Medical Officer for Cherry Health. We're talking about all things healthcare. Join us as we speak to innovators, industry leaders, and the people working to drive the healthcare system forward. All right, today we are talking to Jennifer Olson. Jennifer is the Interim Chief Innovation Officer with Covenant Health. She started her healthcare journey when she was in elementary school, volunteering in long-term care and group homes. This passion led her to complete a bachelor's degree and master's degree in nursing. Having worked in several clinical areas and serving in a number of leadership roles across the continuum of care, she's known for her collaboration and solution-focused approaches. With a strong passion to push the boundaries for what's possible, Jennifer thrives on exploring new and creative ways to make a difference for those she services, which continues to build on Covenant's legacy of innovation and service. Jennifer, thank you so much for taking the time to chat with us today. We really appreciate it.
Yeah, thanks so much for inviting me. I'm excited to be here.
And so for anybody who's living under a rock or perhaps just outside of the province of Alberta, could you give us a little bit more background on Covenant Health? You guys are sort of like an alternative branch to Alberta Health Services, essentially. You have your own hospitals, you have your own clinical organizations. Can you give us just a little bit more of a high-level overview there?
Yeah, you bet. As you mentioned, we say Covenant. If you do know who we are, you think the Grey Nuns Hospital, you think long-term care centers, but there's so much more that people don't know about Covenant. So Covenant really, cares for Albertans over the span of their life. So from birth to death. As a matter of fact, most people don't know that 1 in 5 babies in this province is actually born at a Covenant health facility. And
myself included. I was one of those 5.
There you go. So, Covenant for us is a family. So it's comprised of Covenant Health, Covenant Care, Covenant Living, as well as our Covenant Foundation. And we actually have multiple sites across the province. So whether you're in rural or urban, chances are that you've either seen or at least driven past a Covenant facility. The one thing that people also don't know about Covenant is we're really starting to push the boundaries into innovation. And so our board has actually challenged us to do things differently, do things better. And so with that being said, we've really started to kind of delve into this realm where we're starting to push the boundaries of the impossible. So we've started to do that within our seniors perspective and palliative and end-of-life care, as well as rural. And now we're finding ourselves getting into addictions and mental health and the community sphere. And, it's really just exciting. It's not just about acute care and long-term care. We're really kind of partnering out there with, different technology providers and startups. And, we're getting to play this really unique role within the ecosystem.
Well, and so how did you yourself get started sort of on that innovation side of healthcare? I mean, it's something I'm personally passionate about. I think is, absolutely critical to the functioning and future success of our healthcare system is focusing on these things that are innovative, novel, disruption, and sort of breaking away from that status quo. How did you begin on your journey in this space?
Yeah. So as we kind of mentioned earlier, I actually started, quite young and started as a healthcare aide. And that was back before the HCA curriculum actually even existed. And from there, I actually decided I was going to be a pharmacist. My mom told me I was going to be a nurse. I said, no way, I'm going to be a pharmacist. And so I went to a year of pharmacy school, and lo and behold, she was right. So pharmacy wasn't my jam, but nursing was. And so when I was in that nursing, sphere, I found I really liked the problems. I wanted to be able to find solutions to things that were happening on the unit, to things that were happening with families, as well as the patients that we were serving. And, nursing is such an amazing journey. You can really, be in so many different atmospheres. So took care of older adults, spent some time in trauma and emerge. And, through all of that, ended up in the private sector where really my passion for innovation started. And so you started to see problems. You were in the system where you're like, hey, I know a solution, or I can find a solution, or I can partner with people to do something new and cool. And from there, really, I just got hooked. Like, to me, innovation is addictive. It's so amazing to find new ways of thinking about problems, new solutions, and then getting to see them in action, right? Really getting to see that something has changed and you've done something for the better. And so from there, I actually found myself at Covenant in a director of our network of excellence in seniors health and wellness. And, really got to delve into a whole, load of amazing programs. And, from there, just my journey has been sparked even further. And that's kind of what led me to take on this role.
It really starts out from just that frustration, the lived experience as the boots on the ground. It's
Yeah.
frustrating. You're like, there has to be a better way. And it turns out there is better ways to do things. It's just sometimes challenging to actually get there, especially when you're dealing with organizations and processes at such scale.
Absolutely. And I think that's, something that I've always brought to this role, which is, we don't innovate for the sake of innovating. There has to be a reason we do it, right? There's some challenge or problem that we're having, and it needs to make life better for people. Because if we are not doing that, then we've missed the boat. And so, like you said, like for me, it was just all about how do we do it better? How do we make people's lives better? And, that's what keeps me passionate every day and coming back.
Was there like a specific thing you remember, the straw that broke the camel's back when you were nursing? You're like, okay, I got to get into like the systems change side of things, like patient care one on one, excellent, great, needed, but like something's got to change just from how the bigger picture works. Was there any like example that you're like, okay, this was kind of my eureka moment? I knew I had to do something.
I actually think it was when I was working in a long-term care home, and it actually revolved around the staffing model because we were, always ensuring, the right person does the right job at the right time, but we didn't really follow that at all. And then you started looking about why is there a person doing that job at all? Right? Like there were so many back end improvements we could make. Like I remember doing things like, just something personal like vital signs or whatever. And like people were like literally charting them on a scrap piece of paper. Someone would bring them back. They'd put them in an Excel file because that was before the days of electronic health records, etc. And then they would print it off and they'd put in the chart. And you just look at how many steps it took. And, it was literally examples like that. We were like, I don't know why we've now allowed 4 humans to touch work. That if we had just put it into the computer in the first place when we were at the point of care, we wouldn't be doing that.
It's just so wasteful and unnecessary, I guess. The number of steps, not just work wise, but chances for error to get in there, for mistakes to happen, and just yeah, it's annoying for patients as well.
Absolutely. And then we actually also had this one gentleman who I was caring for, and he had Parkinson's. And, for him, he always felt like he was a bother when he was asking us for help. And we had actually found one of these robotic feeding devices where he could control it because the, controls were lower down where, it didn't matter if he had tremors. And, just watching the dignity and quality of life that brought back to him, when you see something like that, you can't not tell me that innovation is necessary. When you can now allow someone to do for themselves what they desperately want to and not have to rely on another human, like it's such a wonderful, wonderful thing to watch.
It's just the wow factor that would come from such a moment. It sounds very powerful.
Yeah, for sure.
And so, an organization like Covenant Health, how do you guys actually approach innovation? Like what does that mean to such a large organization with such large budgets and headcounts of staff? Like, where do you even start?
Right? That's an excellent question. And I think with that being said, for us, innovation really is on a scale, right? Sometimes it's just about doing things differently. So it can be a process, it can be a product, it can be some sort of improvement that we're making. I think for us, the one thing that needs to kind of be front and center is it needs to solve some sort of challenge or issue that we're having. So for us, it can be the little things like, hey, we're trying that robotic feeding device that I was just chatting about. It can be something, around an alternative staffing model, like let's try and have different people do different work with different skill sets. Or it can be something huge and amazing, like let's get into the world of digital interoperability. So for us, it can be projects, it can be huge conceptual frameworks. We've got a few larger projects like our Courage project, which is, an initiative that we have with SC Health, which is all about how do we reimagine aging. And that in itself has branched off in innovation in so many ways, right? There's alternative models of care playing into that. There's different technology and how we embed that into everything that we do. But then there's also that kind of grassroots movement of how do we get people to see things differently and use their voice and push for change? Because, innovation really is just about how do we creatively be open and willing to think about doing things different and then to actually commit to doing it. So like for us, it's also a little bit iterative around like the who's involved in the journey and where do they want to take that? Because again, innovation can be small, but it can also be big. And yeah.
How does it even, let's say you put a call out for a project or an area of focus. You mentioned a few of those. Like, how did those even get flagged? Is it the squeaky wheel gets the grease and maybe the CFO is the squeakiest and it's something budgetary? Or do you like actively seek feedback from staff at all the different levels or from patients? Or, I mean, there's just so many different things ongoing and types of processes. How do you even filter out and start actually pointing at the big problems and the big fish that you want to start going after?
Yeah. So I would say three ways. I would say the first way is we've done a lot of needs assessments around our end user challenges. So whether that's actually going out to sites and chatting with staff or having them give us a call because they know that they've got some sort of challenge that they're looking to, rectify. So yeah, there's that. We do that through surveys as well. So we've got a bit of a process that we've put out there where staff members can, share their ideas of what they think innovation is and what would make their workplace better. But sometimes you just don't know what you don't know either. And so that's where our vendors come in because there's lots of cool things out there. And sometimes it's about aligning the challenge with the solution. So for us, we've spent a lot of time getting ourselves familiar in the ecosystem. So we're part of great organizations like the TELUS Accelerator Program and Plug and Play. We've got friends at Alberta Innovate and Can Health and all of those great folks. And so from there, often we just have a lot of chats with different vendors and figuring out what's out there. They fill out a bit of an intake form that we have. And then sometimes we get to play matchmaker in our innovation portfolio where we get to match up someone that's got a really cool idea or solution with our operations folks that have, a challenge to meet. So for us, I think the beauty of Covenant is, like you said, there's so many ways into that innovation pipeline, as we call it. And so for us, because we're still also maturing in this system a little bit as well, is we don't close any doors. We try to keep all of those doors open and really explore what people have to say. And, from there, if we don't have that solution that we can immediately match make them with, then we go out and we try to find them a solution that fits their needs.
And so not only are things coming internally kind of up the food chain and seeking those reviews out and that feedback, but also keeping your ear to the ground, talking to the startups and the incubators and the innovation ecosystem of just, as you put it, like we don't know what we don't know. What else is out there, and being open to those conversations, I think is a really powerful mentality, especially for, again, organizations at this level.
Well, and of course, also keeping our pulse just on the health system in general, right? Like, I mean, there's lots of changes, as we know, going on within Alberta, but there's also amazing lessons learned from other countries. And so a lot of the work that we've been doing through needs assessments and environmental scans are also showing us that, sometimes it's also about bringing great ideas from other places. And so, for example, one of the projects that we're involved in right now is actually using microfacial technology where we're looking at residents that have cognitive impairments and measuring what's happening with their face in addition to other assessment parameters to find out if pain is an issue for them so that we can more successfully actually assess for pain and then treat for pain. And so that's coming out of our friends in Australia, for example. So
Very cool. And what's the status of this project? I mean, that sounds amazing. So this is an augment to the healthcare aid or the nurses' tools of, okay, like we'll do our vital signs and our subjective assessment, but also we're going to get facial recognition software to try and point out a patient's pain score. That's amazing.
yeah, so where that project is at is we've actually just completed our pilot piece of the project. So we're in the data analysis phase. So hopefully within the next month or so, we'll actually have a report written in terms of how that all went and, what our return on investment would look like and how did it benefit we're taking it both from a larger population health perspective, but we've also delved into a cohort of residents that we've noticed that it potentially made a difference for in terms of their quality of life and, what their treatment and care plans have looked like. So yeah, excited to potentially share the news within a month or so.
Very cool. Any other fun projects, past or present, that you guys have been working on that you think are really neat?
I would say another kind of cool one that we're working on right now is an amalgamation of digital health. So we've got one of our Covenant Living sites that doesn't have an electronic health record platform. But we thought, why stop there? Wouldn't it be kind of cool if you could meld it in with the ability to communicate with health professionals, to communicate with your family? There's also a component of self-assessment where the resident can document their own vital signs, but then it also has resources specific to the resident and what they want. So if they want, ways to help them sleep or exercise programs, et cetera. So we're really kind of building this unique framework, which is a hybrid of the electronic health record, but also things like reminders, communication tools, et cetera, all into one platform that's resident driven through the use of a tablet. And I actually just attended the soft launch down in Calgary on last Thursday. So residents were super excited to get their tablets and to see their personalized resources all uploaded. And so hopefully within the next, 3 months or so, we'll get an opportunity to see how that amalgamation has worked. And, really excited to work with our partners at Got Care on that project, thanks to the funding that we've received from the Can Health Network.
Amazing. Okay, shout out to Can Health Network. I literally just got off a call with them 15 minutes before we started. They are everywhere. That's awesome.
They
I
are.
mean, the topic, patient engagement in general, this is just sort of the bane of every practitioner's existence of like, okay, we know what we got to do, but then how do you don't have enough time to follow up on a patient with all the minutia and nitty gritty little things. So I love to see that you guys are going more towards that digital patient engagement side of things. And then not even that, but integrating it within the EMR as well. That sounds amazing.
Yeah, and actually, as you said that, you reminded me of something else, which is so every day the residents that have a tablet will actually do a wellness assessment. So it basically is a scale of happy faces in terms of how you're feeling today. And so the great news is that automatically gets pushed to our staff. So, if you're having an off day and things aren't going well, then staff members know that right up front and are able to kind of intervene and, come chat with you sooner than, allowing something to brew and then something happens. So we're excited to see that component as well, really pushing the wellness aspect.
Yeah, no doubt. Well, just culturally, we're really making a push towards mental well-being, right? Like we've got the heart and lungs and the kidney fairly well dialed in as a society of our medical care, but definitely like paying more attention to just that holistic wellness approach, I think is going to be, again, a huge focus for all over the place going forward.
Absolutely. Completely agree.
But how do you guys actually come to deciding on these different areas of focus? Or what are some of those current areas of focus where you guys are putting together projects or starting the call outs? These are all incredibly diverse things that you've mentioned so far. And I'm sure they go even further beyond that. And then even how do you, I guess, calculate or start measuring out the return on your investment for something that's reducing pain scores? How do you start figuring out how much of the budget to assign that? I don't know. Can you speak a little bit to just how you arrived at perhaps some of your current ongoing projects?
Yeah, for sure. So our innovation portfolio right now is heavily focused on our seniors health aspect. So it's one of the areas that's part of the portfolio. And so knowing that we have such a large footprint, it just seemed like a natural place for us to really kind of dig in. So for us, yeah, it was about, chatting with our sites, understanding what our indicators show us, where there's opportunities for improvement, but also where families and residents have told us that there's opportunities to, really pursue innovation. So we actually have a resident and family advisory committee that's attached to the innovation portfolio. And this was actually an area that they identified for us, that they wanted us to see if we could do something different. So for those that have loved ones that have cognitive impairment, they're always wondering, have we caught everything that we needed to? Is the change that we're seeing legitimately because of their health condition, or is it because we haven't caught something that they can't communicate with us? So we really do take that kind of person first approach in terms of, identifying where it is that we want to focus. And then, of course, in terms of the ROI or trying to figure out, what that looks like for us. I mean, again, for us, the ROI comes after us trying to figure out that we're going to solve something that really does need to be solved. And so ROI for us, is calculated in many different ways. I mean, clearly everybody's about the dollars because at some point things cost money to implement. But there's a lot of the intangible pieces like quality of life and how much time staff save and how, confident and comfortable they feel about the care that they're giving to residents that also factors in. So for us, definitely there's those hard call outs, but we don't ignore some of those intangible pieces that definitely are really, important to folks as well. So I would say, that's kind of what we're focusing on at this point. And then as we become more sophisticated and we start getting ourselves into some other areas, our processes will look a little bit similar, but we've also obviously had the opportunity to dig into, areas where maybe our health outcomes show the need for us to kind of think about doing things differently. But then also with health workforce shortages, opportunities to find out where there's some efficiencies and effectiveness that we can kind of lean into there as well.
Well, I'm glad to hear that it's sort of that multi-sided approach there, right? I mean, of course, there's budgetary restraints, but then also, just advocating for those that don't necessarily do a great job of advocating for themselves and the large portfolio of seniors and facilities. I mean, that makes a ton of sense that would be a big area of improvement going forwards. And certainly, like now that we've got all these different AI tools coming out, the technical revolution finally starting to catch up in healthcare, it's good to see that it's being put to good use.
Absolutely. And then, of course, we've got strategic projects as well that drive where our innovation go, right? So we've got our Covenant Wellness community that is being built in Southeast Edmonton right now, and really a unique building where we're kind of bridging acute care and community. So, I mean, the whole premise of the Covenant Wellness community was to take some of those services outside of acute care and move them to a place that doesn't need to be acute care focused. So a lot of our ambulatory clinics and such will be moving over there. But how innovation intersects with that building is, we've had the opportunity to start from the ground up. So we've really been building that campus with innovation in mind. And so, for example, one of the projects that was really important to that community was the, patient experience. And so we all know that when you end up in an acute care or, a large campus or clinic, it's impossible to find your way around and you're late and you're stressed and you don't know where you're going. And so we're actually finding ways to do digital wayfinding. So more than just your kiosk at a mall, but how can I actually take the invitation you sent for my appointment and how can I use that to navigate me to the building, but then within the building itself? And to do that in different languages and using voice activation and for those that have visual impairments. And so sometimes the innovation also is just an opportunity to start off on the right foot. And so we're also taking that, approach at our new community as well.
Well, it's interesting because there's probably not that many organizations of this size and scope that have the opportunity to start vertically integrating and innovating from that ground up model like that. So it's a very unique situation to be in.
Yeah, no, we're super stoked because, it can be the little things like that, but it can also be about how the building operates, right? Like there's so many things now where, you can just set the building up to tell you when there's a problem and you don't necessarily need to do all of those checks that, we all kind of are used to doing. But we can also really look at it from like a what do we want to be, right? Because there's the what we need to be, which is obviously something that's super important. But then it also becomes the how do we make it better just because we have the ability to do that right now. And so looking at a number of different innovations, right? Like waitless waiting rooms, like wouldn't it be cool if you didn't actually ever have to wait in a waiting room? Because, that's all being digitally managed and, essentially you'll tell us when you're ready to see us. And, so many innovations. I could keep going on and on, but like you said, the opportunity to start with something has been such a unique opportunity for Covenant and one that we're definitely, grabbing onto and loving every minute of it.
Can I ask more about where does Covenant see itself going? Like again, you guys are already at the being an integral, critical part of the province's healthcare system here, like the large facilities, the living facilities for seniors, the hospitals themselves. How do you see, I guess, foresee like the 10-year plan? Does that change at all? Is it similar scope or is it quite diverse or different?
Yeah, so I think what I would do is I would lean into, the sisters' legacy. So the sisters that had founded Covenant, and for them it was all about what is our unique niche, right? We need to be doing something that others are not doing. Because if we're not adding value to the system, then we need to stop and let others that are doing it better than us do it. So I think for Covenant, it's about, really taking care of those vulnerable populations. And that's where we find ourselves really kind of foraying into some of those different areas. So addictions and mental health and our rural care strategies becoming, even more important. This year we've added an Indigenous strategy. So for us, it's about how do you meld with, what the health system wants and needs and where it needs to go, and how do we take our mission, vision, and values and really find our unique edge there. So I see us really, taking hold of any opportunity that comes and really kind of doing the best with that. Like innovation, for example, is another fantastic example where we've been innovative all along for the last, 155 years plus. But what that means now is evolving, right? So innovation isn't just about being good stewards of resources and doing things that we didn't think were possible with very little. It's now things like, how do we take multiple devices and make them speak the same language, for example? So yeah, I think for us, we're opportunistic and we're kind of following where the needs, take us. And then, of course, really focusing on our vulnerable populations and making sure that, health equity is for all.
Well, so I love to hear that. And especially, again, the vulnerable population side of things, the indigenous health, the addictions. I mean, such a space has just gotten so much more drastically needed ever since the pandemic. Isolation started to hit, addictions, overdoses have been through the roof. So, definitely another, I'm assuming for a while, still going to be growing and needing more attention.
Yeah, absolutely. And I mean, here's the thing, like just as a population, you look at where we've come from and where we're going, and we're not going to be able to recruit ourselves or build ourselves out of the crises that we find ourselves in. So I think that, innovation is well placed, not just within Covenant, but within the health system in general. Like we have to start, thinking smarter and, you know, finding ways to really make sure that every single thing that we're doing counts to its best possible way. Because we're going to have no choice. Like innovation used to be this nice to have, the shiny new, what's cool, what can I do? And now it's like, we're not going to survive if we don't do it. So let's, hop on board and figure out what it means.
Yeah, it's just the system is kind of getting to its breaking point here in recent years, and I don't know. I dare speculate on what rock bottom looks like, or if there's still a
Yeah,
basement to
I'm
go
with you.
below where we're at. So yeah, definitely.
Yeah.
And then when it comes to you mentioned briefly sort of the wellness community. I actually saw the quite the impressive footprint and scale of it when the ground broke when we were up in Edmonton not too long ago. But correct me if I'm wrong here, but the premise there is it's a seniors living facility and then embedded and integrated with all the different types of living supports, allied healthcare professionals, and basically like small clinics and businesses adjacent and within the building that are going to be needed. So kind of like taking a step back from that bigger picture meta of how do we actually set people up to succeed in the community, like, and more so than being like an inpatient acute care facility. Am I missing anything there?
Yeah, so I mean, I would say just the reverse order a little bit. So, yeah, community is definitely the premise of it. So, our first phase that's going to open in summer of 2025 is actually the community health center. And so that's where all of the ambulatory clinics from Grey Nuns will move. It'll be combined with probably primary care or a family medicine clinic of some sort. That's where your medical retail come in. And then, yes, definitely there'll be an integrated continuing care center there it won't just be a run of the mill continuing care center. It will be more focused on restorative care. So how do we take those residents that no longer need to be in acute care and wrap around those supports and essentially be able to rehab them to the point where we may be able to get them to go back to an alternative level or an alternative setting. And then with that, there'll also be multi-generational housing coming on campus as well. So we're thinking about it more of a campus where, each part contributes to the overall wellness of the community. And then if you wrap around those supports, cool things will happen, right? So if you've got a large proportion of seniors living within those multi-generational buildings, things like naturally occurring retirement communities just make sense and will probably start to form themselves there, where you don't necessarily need people going out for support. Supports can come to them. So when you think about some of the cool concepts like New Brunswick, and they've got the nursing home without walls, we're thinking the Covenant Wellness community could be something very similar, where not only will we care for the people within our four walls, but also in the larger community, because we'll have those services and we'll have that ability to really kind of extend the support out and welcome the community in. And yeah, it's going to be so instrumental and a great way to showcase how care can come to you in the community.
Forgive me, what is the nursing home without walls concept?
Yeah, so think about it this way. So, like, if you're a nursing home and you're caring for 250 residents, if you think about the services that your greater community needs, like, for example, if I'm an older adult and I'm having trouble showering on my own, and if I could come to your facility and shower, or if I could come for a meal or exercise, or maybe my physiotherapist is only a point 0.5 at the nursing home, but I can service the greater community for the other point 0.5. It's just really showing how those things can work symbiotically, and we can start to allow people to age where they're best suited to age, because not everybody needs to be in an institution. As a matter of fact, 80% of people who live have support that isn't in an institution. So yeah, the concept is just about how do we bring care to you using the
I
resources.
love that.
Yeah.
The in between, I guess. I mean, there's a lot of people in the hospital, in the acute care facilities, who are just awaiting disposition, right? They get stuck for weeks, if not months, just trying to sort out, like, okay, what is the appropriate level of care here? And then at the same time, there's tons and tons of people, like, essentially stuck in their own homes. They're like, we really don't want to go into the hospital, but we're really struggling here. They don't want to go in and get an infection or whatever else, and they're like really having a tough time, feeling stuck. And so it sounds like this is going to be a great bridge to that gap of how to connect and have that kind of in between level of support that so many people need.
Absolutely. I mean, our research, of course, and research in general shows that, the social determinants of health are, the guiding principle of what generally keeps you at home and keeps you well without needing, additional supports. Healthcare is a very small piece to that. And so there are also areas that we're exploring in addition to support navigation, because we also know that to find those supports can be very complicated. Even as a healthcare professional, when I have friends or family that call me wondering where to go or who to talk to or how to access services, there's even times when I'm finding myself going, I don't know where I need to go or how I'm going to access this service. And so we're finding that, if we're wanting to push people to the community and, do what's right, and so much of the care can be provided in the community, we're going to need to also bolster that support that helps people find what it is that they need to find. And as we were mentioning before, some of those services aren't people. They might just simply be, technology or devices that might be able to kind of help with that. So it's exciting times ahead. I think that, for those that lean into the unique challenge that we have in front of us and are passionate, I think that, we can do amazing things.
Very cool. And when are the first units actually going to be ready to become occupied?
Yeah, so phase one with the ambulatory care clinics will be opening in summer, as I had mentioned. And then in terms of the integrated continuing care center, TBD at this point. So, I mean, conceptually, we've got it all mapped out, but that, of course, will go in alignment with government priorities and, where, funding pushes us as well. So I would say that, again, it's one of those opportunities that Covenant is staying open to. We've definitely got thoughts about where we want to go, and we want to partner, both with government as well as other organizations to really make that kind of a showcase opportunity of, if you wanted to start from a restorative lens and work your way back, what would that look like?
Very cool. And what kind of partners are you looking for? I imagine there's probably many different potential people out there at this point that would be a great fit. What does that ideal partnership look like?
Yeah, so as you mentioned, like the world is our oyster in that aspect as well. So always looking to partner with our friends in the technology community because again, so many great things that we can do there. Also looking to partner with our academics. So obviously it's really important on the things that we do to make sure that we're evaluating them and we can showcase the value that, they're bringing to the system. So looking for those partners as well. And then often funders, we also want to make some good synergistic partnerships with funding opportunities. So yeah, for us, partners are really everybody. And it can even be as simple as someone who has a great idea, right? So I think that I don't want to pigeonhole who our partners are. I would say we're welcome to hearing the conversation and to kind of entertaining whether or not that works.
Open and flexible. Awesome. And then for the individual units themselves, how does it actually work for the occupant, like the patient or the person living there? Are these truly like independent community buildings, like they're purchasing them or they're leasing them? Or is it you are now in like a long-term care facility, more like that type of model?
Yeah, so it will depend on which building you end up in. So the integrated continuing care will simply be, you'll be assessed and approved to utilize those spaces in a fashion similar to what you see in the health system now. But in terms of the multi-generational housing, that will be essentially, public-private partnership that we have with our Rohit folks. And so those would be for rent. So definitely it's sounding like they'll end up being a mix of market housing as well as trying to keep that, multi-generational lens, because we know that that approach is also something that, is really important to keeping the continuum of care active and well working.
Very cool. Very cool. And then where do you foresee the future of innovation in healthcare going in general? I guess like kind of stepping out of your um, role with Covenant, like where do you see the healthcare system at that bigger picture going?
Yeah, I think that's such a wonderful question. And I think that my answer is going to be as far as we want to take it. Because at the end of the day, I think that if you have an open mind and you're willing and able, really we can push the boundaries to, insurmountable abilities. And so I see us actually delving in, of course, to artificial intelligence and machine learning. I see robotics playing a huge component of what we're doing, both from a service and hospitality type aspect, but also just in terms of back end and some of the processes that are happening there. I envision a place where, technology based on what the resident needs is available to all, right? So digitization is going to be an amazing opportunity if we harness it in the right way. So I think that, for me, it we can push the boundaries wherever we want to. I think that the caution I provide people is to make sure that we do it in an equitable manner because there's all of this great technology that's out there, but I think that also what the pandemic highlighted for us is that not everybody has the same access to things that we now consider day-to-day stuff, right? So I think about my parents and, COVID and everything got pushed online and simple things like trying to make a doctor's appointment or go to the bank and all of a sudden everything shut down and they were all pointed towards online. Well, that didn't do, my dad any favors. He didn't have a computer. He didn't know what that meant for him. He just didn't know how that would work now. So I would say we'll take it as far as we want to. We just need to make sure that we don't leave people behind when we do that.
Oh, certainly. I mean, access to care is, quite the broad problem across everywhere. And then you add in looking at the equitable access to care, it starts getting even more challenging. And definitely technology, I would say, is probably one of those biggest gaps in there. I mean, there's geographic, but also, yeah, just computer literacy. And being able to follow through on some of the stuff. I see it even with my own panel of patients and their ability to like log into the secure email portal system just to, book things or send forms back and forth. And it creates a lot of challenges for the nursing and the admin staff trying to figure out their workflow. And okay, every once in a while there's a bump in the road and it gets disrupted, and how to not get lost in the shuffle there and fall through those cracks.
Yeah, well, and then even technology, because things move so quickly. You think about something simple like hearing aids, right? And I mean, devices are only made to last for a couple of years now before you're meant to move on to the next generation of hearing aid or phone or whatever it might be. And we have to remember they don't come cheap either. So it's not even essentially about the ability to use it. Sometimes it's about the cost of whether or not you can afford it. And so, that's definitely something that as the world pushes forward into this digital era, I think we just need to make sure that, whether it's a framework of making sure that we're not iterating so fast that people get left behind, is it funding that we need? Like, I don't know. I'm curious kind of about what your thoughts are based on what you see in your practice as well, because there's, it's going to have to come together somewhere.
Oh, 100%. I mean, the technology side of things and the innovation there, you mentioned the AI piece as well. I mean, personally, I'm pretty hyped on the AI side of things and that potential to minimize work, reduce that administrative burden, reduce the costs. I mean, there's kind of some interesting examples of like AI kind of starting to replace physicians now in the States. You could just walk into a booth or a kiosk in the middle of the mall and chat GPT or whatever the medical version equivalent of that is, goes through your history, and then the doctor reviews it somewhere in a bat cave far away remotely from there when it's done with you. But like we're getting to that point. I mean, like I've got my like primary care blinders on. What are you actually seeing at the conferences and the trade shows when it comes to like these AI innovations? When it comes to like bigger organizations and like having large facilities, multi facilities, and just the processes that you're dealing with. What's like the hottest commodities going on at trade shows right now?
Oh my goodness, I would say probably the hottest commodity related to AI would have had to been inventors where, they had the robot and it was very interesting to just watch a conversation occur and for it to be so iterative and so thoughtful and responsive and real. And I think that, in a room full of thousands of people that day, I think that everybody knew it was going there, but I think that having that opportunity to just interact, and then we ourselves got to go and interact. And it was just amazing. Like when you think about what's possible, I think it was exciting but scary, like, of course, at the same time, because as you're mentioning, you kind of, you walk away going, huh, like I wonder how long until I'm replaced, right? But it's for the better. So I think that it's one of those things. But AI in general, and in terms of what you're talking about at conferences, like we're seeing, AI and just machine learning and robotic automation really taking the world by storm, right? Like in terms of how do we use that to pull in a bunch of data to get, to diagnostics answers faster. It's being used in the procurement world clearly in terms of what that looks like. I think people are starting to play with it with everything. Like I think it's already integrated into so many things that people don't even know, right? You just think about simple hiring platforms and how algorithms push you in the right direction already. Like I think that that's the other piece is people think it's coming, but it's here and it's been here for a long while. We're just more cognizant that it's here now, right?
Yeah, Chat GPT 3.5 hit the market there a year or whatever ago, and just immediately like AI became a household name overnight, and people just started seeing all kinds of different use cases for it. I personally, I'm really excited for that side of things. I use it, pretty much most of my clinical days to help with my charting and my note taking. And then the next step that's going to be coming soon is going to be the actual integration of it to start doing tasks and follow ups and filling in forms. And eventually it's just going to continue to grow from there. And I don't know. I'm sort of on the side of, when Skynet takes over and tries to eliminate humans, I wanted to know that I was an early adopter and a friend. But I think like, what's that?
Are you seeing any patients using the AI scribe or other, alternatives? Because, I've started to see some of our residents start to ask about it, like, hey, can I use this so that I can record my appointment because I'm going to forget? And, I want the ability for it to kind of summarize it and put it into layman's terms for me. Like, are you seeing the flip side any?
None of my patients have asked to do that yet, but I can see that as being a tremendous application. I mean, if you're just non-native English speaking person, if your health literacy is not great to begin with, if you're, I don't know, cognitive decline or any kind of challenges there, I mean, having the llama instance of chat gpt running and helping keep track of everything, give you your follow-up notes and like next steps, I
Yeah.
think there's a ton of potential for exactly what the clinicians are doing with AI right now, for the patients to be doing with AI right now. I think there's a ton of potential there.
Yeah, absolutely. When I was at, I think it was in Ventures as well, and they had made the comment that, pretty soon it will be about whether or not the patients are willing to share their health data. It won't be about us being, the holder of it anymore. And, that thought is just so exciting to me because I think when you think about people and trying to get them engaged about their health and to be, self-sustainable and, really pushing their own health agenda forward, like tools like that to me are, change the game, frankly.
Oh, exactly. I mean, there's a company out of Calgary here, and their entire mandate is helping send people either in person or via the phone, like a nurse or a healthcare aide, to try and like act like the scribe and help things actually get noted and taken along with them. And so the next evolution is going to be augmenting them with AI. I think there's just so much potential for AI to like really revolutionize and speed up and improve the delivery of healthcare across the whole country. I'm definitely very bullish.
Yeah, I completely agree. I can't wait.
So yeah, definitely there's a ton there. I think at some point, like all the doctors are going to be walking around with Apple Vision Pros on their heads, and then the AI is going to be making notes and telling you which questions you should have asked or haven't asked yet, or other parts of your differential diagnosis to consider, weird and wonderful diseases. And it's just, I think a person, in general, whether you're a clinician or whether you're in a completely different field of work, the people that are going to be able to sort of augment themselves with the AI as it comes in are going to be able to just be so much more uh, advantaged compared to everybody else. And I think that's going to be a big part of medical education going forward. It's just trying to stay up to date with all of it.
Yeah, I love that you brought it up. I mean, later in the month, I'm a judge at, a competition for, something that's going on. And, we've been having these conversations of like, you think about schools and how fast technology and innovation is really iterating and what is it that we need to build into programs now? Because, you know, it's a big jump to just even kind of get them up to speed with how we're using it now. But how do you prepare people for what it's going to be 2 or 3 years from now? Because we're going to be light years ahead again. And, I think that it's fascinating and, it's something that we do need to get students kind of, well versed with, not only just the technology component, but the thought of innovation and about how we are going to push the boundaries and do things differently. And yeah, I think that's another area that as we're starting to kind of reform or transform the healthcare system, depending on how you want to look at it, that we need to make sure that we're doing that across the spectrum because everybody's got to be prepared to kind of play their part.
Well, I think a big part of it is going to be the culture shift, because maybe you could speak more to the nursing side of things, but certainly on the medicine physician side of things, we're definitely a little bit more conservative and risk averse and slow moving when it comes to doing things differently. And I think, I don't know, a lot of us just come from like a science background of like, okay, well, show me the literature, be critical of the literature, don't trust it even if it looks credible, try find another one or an RCT to back it up with. Anytime there's something that changes in terms of like patient care, medications coming out, okay, what are the reviews, what does the evidence look like, how is the sales rep trying to scam me into using this medication that costs more and doesn't deliver better outcomes? And so it's just very, I don't know, then that rolls kind of downstream to the technology side of things, and people just tend to be a little bit shied away from it, I think. Is it similar in the other sides of healthcare? Do you see that at all?
Yeah, I think that's standard for healthcare, like definitely the risk averse piece. I think the other piece is, I mean, we've been regimented in school and just in the way that operations works that, there isn't a lot of room for failure, right? It's very success driven. It's very, you have a finite amount of time, you have a finite amount of resources, and therefore you must deliver. I think the other interesting thing that I've heard a lot is people saying, like patients aren't ready for innovation. And, I've always kind of thought, myth. But then this week, when I was down visiting residents in Calgary, I was chatting with them about innovation and what did that mean for them and, how they felt about it. And it was very interesting because, they themselves aren't averse to it. They're open. For them, though, it's just about how does it make it meaningful to me? That's the first thing is I just don't want you to do something to me. I want to be part of it and I want to know how it impacts. But for them, it was about the people. They didn't want to see people go away because of innovation. And I think that out there, there's this myth that if we're going to use technology, that it means we're not going to have humans doing any work anymore. And I think that it's, up to all of us to flip the script a little and to really help them understand it means that your humans are never going away. It means that your humans are actually spending more time with you doing things that human to humans should do. Right. And so we were having quite a fascinating discussion. And, when we started to kind of explain, like, I'm not taking humans away by us doing these types of things, but I'm trying to find ways so that they can spend more meaningful time with you. Because as you pointed out, like, you don't want to spend all day charting, right? Is it resident care anymore when you spend all day charting? So, yeah, I think it's about how we socialize and message it too.
100%. I mean, it's got to go from the provider to the patient, right? So, like, people just generally look to their healthcare team for advice and guidance on what kind of technology to use, where should they be spending their time and their energy, and then, culturally in healthcare, are we a little bit more averse to that sort of fear of getting replaced by the robots, right? Like, I thought eventually maybe kind of, but I think it's going to be a slower shift than you just lose your job next year because a computer system has replaced it. And certainly, like, in the meantime, if you're not being quick to adopt, how do you actually guide your patients to caring for themselves in the best possible manner? You're sort of putting yourself and them at a disadvantage if you're not staying up to date.
Absolutely. Yeah, because I mean, I think about, schools now and, I think about my nieces who, are in grade one and I mean, they're learning computer skills that I probably learned in high school, right? So it's just the shift is here. And so to your point, it becomes the how do we adapt, right? And I think that, we're all going to have to adapt to a certain degree and that's not a bad thing. It's different and it's change, but it's no different than any other change. It's just, how do we manage it and how do we keep ahead of it to the best of our ability? And how do we make sure that we're using it to benefit us, right?
Exactly. And I'm just picturing, like the wellness community and future iterations, is there just going to be an instance of an AI, I guess healthcare attendant that the patients can speak to directly and will start playing their old country music for them immediately afterwards. That's kind of a cool future to imagine.
Absolutely. Yeah. Comes back to our conversation earlier. If you can imagine it, it can probably be done. It's just a matter of the how and how many steps will it take to get there.
Exactly. Well, Jennifer, thank you much for joining us today. One final question before I let you go.
Yeah.
What is your number one health and wellness tip that you personally make sure you're doing to keep yourself going?
Oh, for me, it's all about work-life balance, right? I mean, when you're super passionate about something, you can easily get yourself caught up and going a million miles an hour. But for me, it's about how do you take a step back and slow down and appreciate where you've come from and where you're going and making sure that you yourself are well and can give to the cause. Because if that's the case, then you're ready, set, and go.
The balance is key. Well, if anybody wants to get a hold of you, or is there any last things you wanted to shout out before we let you off here?
Yeah, I would say the shout out I want to provide is, Covenant, we're super excited to know who else is in the ecosystem, and we'd love for you to connect with us so that we can learn how we might synergize or collaborate in the future. And if you want to do that, you can get a hold of either myself or my team at innovation@covenanthealth.ca.
Awesome. Well, Jennifer Olson, Interim Chief Innovation Officer for Covenant Health, thank you so much for joining us this afternoon. Really appreciate it and learned a lot today. Thank you so much.
Thanks so much.